Mary Ellen's asking, what vitamin do you sell that helps strengthen hair and nails? Mary Ellen, a couple different ones. Number one, check out our Ultra Collagen. If you are struggling in your hair or nail growth, whether you've got lines in the fingernails, ridges in the fingernails, hair that won't grow in, hair that's thinning, collagen is one of the best things that you can do. Most people, when they eat their meat, throw away the collagen components of the meat, right? You ever eat a chicken leg and throw away the bone and don't eat the collagen off the tip of the head of the bone? That collagen is very valuable, right? And your body uses it to grow hair and nails, but also cartilage. It also uses that collagen in your skin, right? So ladies, if you're trying to maintain your youthful exuberance, you want your skin to maintain its resiliency and elasticity, collagen can be very, very effective. So Ultra Collagen is the gluten-free formula that we have that contains all 4 classes of collagen to support joint, skin, hair, nails. That's one element, or that's one supplement you can take. Another one is Ultra Biotin. Biotin is a B vitamin. It's sometimes referred to as B7 and sometimes also referred to as B8. But biotin is oftentimes nicknamed the skin, hair, and nail vitamin. So a lot of women do really well and a lot of men do really well with supporting good hair growth using biotin. You can also use a good B complex, that contains biotin at higher doses. And the dose you're kind of looking for in a B complex for biotin from a skin and hair benefit is going to really be at least 1,000 micrograms. If you're buying a B complex that has less than that of biotin, you're throwing your money away if you're trying to get some biotin from it. So very important in terms of the amount, right? The dosing. Okay, so I like this question. Levothyroxine, which is a thyroid medicine, so for those of you on, taking medicine for hypothyroidism or Hashimoto's, levothyroxine contains grain and gluten. Yes, yes, it does. So if you're on, this is another aspect to the program. Some of you are taking medicine, and so you have to look at your medicines. And if you're on a medicine that has a grain-based filler, and many of them do. Many of them have grain or gluten fillers. Levo is one of them. Levo's got, last time I looked at Levo, it contained corn and dairy. It contained them both. And so what you want to do there is talk with your prescribing doctor about getting you the same medicine, only getting it made through a compounding pharmacy. So get the medicine compounded through a compounding pharmacy where they can produce it without the fillers. They can get the fillers out of the medicine. So otherwise, I've seen cases where, where women were following no grain, no pain, and they continued taking levothyroxine, just the standard medicine, and it really, in a sense, they got to a point where it was sabotaging their forward progress. So it's, in my opinion, is definitely necessary to get that compounded. Oh, I like that. That was good. Go back up just a little bit. A little bit more, just a hair more. There you go. Yeah, Robbie says, I made your apple fritters and must say they're awesome. Your grain-free flour is amazing. Thanks for that, Robbie. Shameless plug for Warrior Bread and Warrior Bread flour. If you haven't checked that out, and you're looking for something that kind of fits that bread, that bread craving, right? That's why we made it. It's a low glycemic, low carb, high fiber bread that can be used in lieu of some of the junk, the cardboard bread-based products that are just full of corn, rice, sorghum, millet, and other nonsense that you would get, on the main gluten-free food aisles in the grocery store. Okay, let's see here. Is it safe to do a vitamin C flush every few days to help chronic opioid-induced constipation? Yes, it is, but I don't recommend doing it more than, let's just say, about once a week. If you're doing it every few days, you could potentially dehydrate yourself. Remember, when you flush out your bowels like that, they're pulling water, and that water's coming out of you, so you can dehydrate. So if you're doing the vitamin C flush, I don't recommend going more than every 7 days. and make sure you stay hydrated. Because if you do a flush every 7 days, what you're going to find is, so one of the unique things about doing a flush is, let's say you start at, as I said earlier, 2 teaspoons every 15 minutes. Let's say it takes you, 4 rounds of that. So you're actually getting 8 teaspoons. Well, what's in a teaspoon? One teaspoon, or let's say 2 teaspoons is 6 grams of vitamin C, right? So if you're taking 8 teaspoons, you're getting 4 times that, right? So that's 24 grams of vitamin C. Now, what you're supposed to do after you do a flush, the way you want to take your daily vitamin C if you're trying to high dose vitamin C, but keep yourself from getting chronic, loose bowels and gas, is you take 75% of your flushing dose. So if it takes you 24 grams to complete a vitamin C flush, then you take 75% of that daily after that, and then you can do another flush the following week. And generally the trend is this: each time you do it, it goes down. Your need, so maybe the next time you did a flush, it only took you 6 teaspoons, and then the next time you did it, maybe it only took you 4 teaspoons. That's generally the trend that we see in people, is that their need for vitamin C, as they do what are called calibration flushes, the need goes down, and so they need less and less and less. And this is important because you adjust your dose down if you're taking high doses of vitamin C to prevent, an overly loose bowel movement or just discomfort within the GI tract, because many people get gassy and get rumbly and get uncomfortable in their guts when they're on too much vitamin C. So that calibration allows you to kind of modify and adjust your dose. But doing it every couple of days is not necessary. Really calibrate your dose and do it maximum once a week. Let's see, Emil's asking, hi, my mom is going to have dental procedure including implants. Is it best to detox before, during, or after? What's the best detox? So if you're talking about detoxing before a dental procedure, it's not that a person needs to detox before a dental procedure. A dental procedure, especially like an implant, is an invasive surgery where they're going to drill, generally they're going to drill into the gum. Maybe they've already done some of that, drill into the gum, so you're basically damaging collagen tissue to get that post down in there. So it's not about detoxing, it's about supporting the repair process. So when we talk about, and this goes with any surgery, whether it's a dental surgery or whether it's a hernia repair surgery or a neck surgery or back surgery, you want to support healing. And so you want to do this before the surgery and after the surgery. So think of it as a before and after, because when do you need nutrition to support and heal yourself? Always, right? So it's a before and after the surgery. But I like to use the high dose vitamin C. And so this, again, you would calibrate your dose to what your need is using that flushing protocol. So vitamin C, L-glutamine, and my advice on the L-glutamine for a general adult is anywhere between 2 and 4 grams a day. You also, with surgery like this, you want to include quercetin. And so anywhere with quercetin, it's 2 to 4 grams a day. Quercetin works with vitamin C. These two work together synergistically to control a lot of the excessive inflammation that comes after surgical procedure. Plus, quercetin is very supportive of the healing process. You also in this want to make sure that you're getting the branched chain amino acids, so BCAAs. Branched chain amino acids, about 6 grams, okay, surgically pre and post, to help support what your body's going to need to knit the tissue back together after the scheduled trauma, because that's what surgery is. So these are some key supplements that you can take kind of before and after surgery. And again, it's before and after, about 2 weeks before, and then after the fact, at least 8 weeks after, because there's an inflammatory process that your body's going to go through over the next 6 to 8 weeks after that surgery. Now, one of the things you have to be careful with when you're going into surgery is taking supplements that can thin your blood. The doctors that's doing the surgery will always tell you don't take supplements that thin your blood. That could be things like ginkgo, where vitamin E can thin the blood. Vitamin C will not thin the blood, quercetin will not thin the blood, branch chains will not thin the blood, and glutamine will not thin the blood. So these things you can do, all of this before the surgery. What you wouldn't want to do, though, is take any kind of omega-3 before the surgery. So I was talking about omega-3s earlier, and so higher doses of omega-3 will thin the blood. So generally about 7 days before the surgery, you wouldn't take omega-3 supplements, but after the surgery is completed, you would get on this right away. These are also very critical to the healing and repair process, and I would take anywhere between 2 and 3 grams of concentrated EPA DHA omega-3 per day, again, for several weeks post-surgery. So those are things that your mom could make an attempt at doing that would be really safe and be very, very effective at supporting her recovery. Let's see, Carolyn's asking, Carolyn, Happy New Year to you too, Carolyn. So would you recommend taking magnesium to address heart palpitations for a hyperthyroid condition? Thyroid nodules are benign. You can certainly use magnesium and see if that's effective for you as an aid. But more importantly, Carolyn, is go to no grain, no pain, because a hyperthyroid issue, otherwise known as Graves' disease, is autoimmune. And that's why I wrote No Grain, No Pain, was to address the root of autoimmunity. So if you're not following the diet, then it doesn't matter how much magnesium you take, you're giving lip service to the real problem. Because if the real problem is that your body is producing antibodies that look like thyroid hormone and you're stimulating the thyroid metabolic function, you're going to keep your heart in overdrive, and all the magnesium in the world is not going to fix that until you've dealt with why you're producing the antibodies. And in my experience, grains are a major, major part of why that happens. Doctor, could you tell me if Raynaud's is a gut issue? I'm looking for answers the doctors don't seem to have for my mother. I just want to help her. Any insight? Yeah, Raynaud's is an autoimmune condition. Again, put her on No Grain, No Pain. Put her on the 30-day challenge. We see Raynaud's improve in people all the time. It's not just a gut issue. It's an autoimmune process. And there are a lot of different components to going grain-free that can help address why a person can develop Raynaud's. And those of you that don't know what that is, it's when the hands and the feet get really cold and they turn colors from red to white to blue. How to address ridged thumbnails. Have been completely off gluten over 6 months and thought it would improve. It actually seems worse. I already take a lot of supplements. I would look at your protein content. If you've got abnormally ridged thumbnails and your protein levels are too low. Remember, we've talked a number of times about protein requirements, and this is also true post-surgically, but it's very true people changing their diet and trying to heal and repair from a chronic inflammatory process. The average person that's trying to heal and repair needs 1.2 to 1.4 grams of protein per kilogram of body weight. So, if you're under the mark there, that may be one of the reasons why your nails aren't growing in properly and growing in ridge. This is just a suggestion, but look at your protein levels. Can foods other than gluten cause brain fog and stiffness, tension in the body? Yeah, it seems the more I eat a particular brand of gluten-free crackers, the more off I feel. I want bread so bad and crackers. Yeah, you may be reacting to the high level. So those products where you find the crackers and the breads, one of the problems with many of those products for some people is they're high in almond. And some people don't do well with almond, like they just do better without it. Remember, almond is high in omega-6, and if you're I see a lot of times where people have omega-3 fatty acid deficiencies, so they really don't do well with almond because it just creates a greater imbalance between omega-6 and omega-3. And so if your omega-3 is already low, eating high omega-6 foods like almond can drive that imbalance even greater, leading to inflammation and feeling bad. The other is many of these have high carb content, so there's too much carb in them. And so you're reacting in a negative way to the excessive carbs. And so look at that as another potential possibility. So in those types of cases, sometimes it's just a matter of quantity. You might be able to get away with eating a few of those types of crackers, but at the end of the day, quantitatively speaking, if you overdo it, you don't feel as well. So be careful in that regard. What would cause vitamin D levels to not increase even after supplementation of 15,000 to 20,000 IUs daily? Well, there's a lot of caveat to that, Deanne. Number one is what kind of supplement you were using. So number one will be the quality of the supplement. A lot of supplements make claims and they're wrong or they're not true. And if you actually, we send products out on a regular basis to have independent laboratory testing done. And a lot of times the label, what they state is in the product is not actually in the product. And so you get a supplement and you think you're taking a certain amount and you're not really getting it. So that's quality is number one. But remember too, vitamin D is a fat. And so you might have a gallbladder issue. Maybe you don't have a gallbladder, or maybe your gallbladder is malfunctioning, and so you're not producing and delivering bile to the small intestine because you need bile to emulsify vitamin D so that it will properly absorb. And this goes also back to the quality of the supplement. Some of your vitamin D supplements are in a powder form, and so if you have a gallbladder or a liver problem, then you might not absorb that particular powdered version as well. Now, some vitamin D supplements are pre-emulsified, so they're already emulsified, so they, if your gallbladder or liver is not working properly, then you will still absorb a pre-emulsified version of vitamin D. So I would encourage you to look at those parameters. If you're looking for a good pre-emulsified, high-quality vitamin D with pharmaceutical grade testing, check out our Liquid D3. It's emulsified. One drop is 1,000 units, international units. So if you're trying to get vitamin D levels up because they're low on your testing, then you want to, take at least 10,000 units a day if you're an adult to get it there. But I would recommend if you're going to do that, you work with your doctor to get your 25-OH-D levels tested every couple of months to make sure you're not getting too high. I've seen cases where people come to me all the time and they're like, I can't get my D up. I'm on this much, I'm on that much. And these are the main issues that we see in those cases. What could be a possible cause for really cold hands and toes? So that's Cheryl, that could be something along what we were talking about earlier, which is Raynaud's, which is an autoimmune process, which can lead to deterioration of the vascular flow. Now, so going on a grain-free diet might be extremely beneficial in that regard. The other thing you might consider, where we see people that have kind of especially in winter with a frequency toward coldness, is just lack of activity. They're not moving their body enough to get physical pumping of the blood to the distal extremities, and so they suffer from coldness more as a result of a sedentary behavior or lifestyle than they do from, let's say, just an autoimmune process. Juan's asking about supplements for stroke recovery to support a stroke recovery. Number one, hands down, Juan, is omega-3. And you got to get, your friend needs to work with his own doctor here, but 6 to 8 grams of omega-3, concentrated EPA, DHA, stroke recovery, is very important to get the dose up there. Otherwise, you're not going to be effective. How do we know what fruits and vegetables have pesticides and herbicides? Well, part of it is either growing your own or buying organic. Those are your best options in today's world that we have, or working with local farmers that you know and trust. Can constant high levels of antibodies lead to autoimmunity? Constant high levels of antibodies are a sign of autoimmunity, depending on what kind of antibodies that you're talking about. So, it is autoimmunity. That's how doctors diagnose autoimmunity, is they look at your antibody levels to different tissues, and if they're high, they diagnose you with an autoimmune process. If I have positive celiac genotyping but negative transglutaminase antibodies and do not have celiac disease at this time, would I still have non-celiac gluten sensitivity? Yes. If you have positive celiac genotyping, that means you most likely have HLA-DQ2, right? So generally when they do celiac genotyping, they measure for HLA-DQ2 and 8, those two genetic types, 2s and 8s. Those are both the celiac types. Now, these are celiac, and if you have these, but you don't have the other positives for a celiac test, you still need to be gluten-free. And the reason why is genetically, this is what I was talking about earlier. So if this is an immune cell, on the surface of your immune cells an antenna or a receptor called an HLA-DQ receptor. And so generally what happens when you go to the doctor and they do a celiac HLA-DQ typing is they're only looking for a DQ2 or a DQ8. There's also DQ1 and there's DQ3, and these are what are oftentimes referred to as non-celiac gluten sensitivity markers, whereas these are celiac markers, but a person can have the 2 or the 8, not have celiac disease. We would still call that non-celiac gluten sensitivity. But what that means is if you have these gene markers, when you get gluten in your GI tract, and remember 70% of your immune system sits behind your gut wall, right? And so these lymphocytes are concentrated in your gut wall. When gluten docks or binds to that antenna, that HLA-DQ receptor, it activates a cascade that leads to an inflammatory process. And so you're going to end up inflamed, right? So whether that inflammation damages the gut, if it damages your gut, you're going to get villous atrophy, and they're going to diagnose you with celiac disease. But for some people, it doesn't damage the gut. The inflammation goes into the circulation, so it's systemic, not necessarily doing damage to the gut. One of the areas we see this the most is nerve tissue. And so, like, if you look at some of the work of Dr. Marius Hadjivassiliou et al., their crew in Oxford, they've been studying neurological damage caused by gluten, and their findings, sometimes nerve damage is the only manifestation of gluten exposure. I mean, you don't have any GI symptoms at all. You don't have what we call hallmark of classic celiac disease, but you have nerve damage. And so what could this look like? It could look like schizophrenia. It could look like vertigo or dizziness. It could look like neuropathy, numbness, tingling of the extremities, whether it be peripheral neuropathy. It can also look like things like ascending neuropathy, where you get numbness, tingling that travels up your legs and moves up your legs, and slowly you lose your ability and function to walk. I've seen people who are wheelchaired over neurologically induced gluten as a result of this combination of factors. So just because you don't have celiac markers like the transglutaminase or the anti-endomysial antibodies or a positive villous atrophy finding on a biopsy when you do an upper GI scope, doesn't mean that you can't develop the nerve tissue damage. We also know gluten can directly damage the joints and the muscles, so some people will develop diseases like reactive arthritis, rheumatoid arthritis, lupus, scleroderma, dermatomyositis, ankylosing spondylitis. These are all forms of autoimmune, musculoskeletal autoimmune conditions that are prevalent and can be very, very much improved going on a gluten-free diet. So hopefully that helps you clarify, what your other doctors may have told you. Let's see here. I like this question because this was coming up a lot in the feed this week. What's a reliable test for food allergies and food sensitivities? Well, right now, as it stands, you can't buy one online. I get this a lot. I don't like to call out companies who are doing online testing services, but for the most part, the food allergy tests that you can buy online are highly inaccurate. They lead to tons of false positive, and so you end up restricting your diet to such a great degree, more than what you should need to or what you should have to. They're just not super accurate tests, so don't waste your money on those types of tests. I've been saying for the last 6 weeks or so, we're in the process of bringing actual technology to the masses. Meaning, right now you could do it if you came to visit me in my office or my practice, and other doctors can measure it as well, but it's not available direct to consumers, so consumers can't get it. We've been in the process with negotiating, getting this technology into your hands, and we're almost there. I'm hoping that we'll have it here within the next 2 to 4 weeks or so, so just stay patient. We'll be making a big announcement. The best supplement for type 2 diabetic, there's not a best supplement, Nancy. There's a best diet, right? And that's no grain, no pain for type 2 diabetes. As far as supplementation to help regulate blood sugar, food, right? Regulate what you eat and regulate your exercise. Now, there are certain supplements that do have benefits on blood sugar, and one of them is berberine. We have something called ultra berberine, so if you're looking for something along that line. But my favorite supplement to support healthy blood sugar is chromium. Chromium's nickname is the GTF. The glucose tolerance factor is what that stands for. And without chromium, you can develop diabetes. The other is B complex. The B vitamins are necessary to break down blood sugar or sugar and turn it into energy. And so if you don't have adequate B vitamins, you're out of business and your blood sugar stays high. You also need zinc to regulate insulin production and make sure the insulin that you're making works well enough to get the blood glucose into your cells to be able to convert that glucose into energy. So any of these supplements can be supportive of healthy blood sugar. Can you take vitamin D on an empty stomach? Yes, you can. Is nutritional yeast okay on a grain-free diet? No, don't recommend nutritional yeast on the no grain, no pain diet. Why would white blood cells on a lab test be low? Lots of reasons. It's a type of anemia. One of the more common reasons we'll see it, Lucy, is B vitamin deficiency, particularly folate and B12. But we'll also sometimes see it low because there's environmental poisons. A person's being poisoned environmentally slowly over time, and it's wearing away their ability to keep up with the demand of white blood cells. Probably the most common case of that I see environmentally is people that are in toxic mold, people that are living in an environment where they're being exposed to toxic mold. Okay, let's see here. Can you do coffee enemas when you say stay away from coffee? Yes, you can do a coffee enema if you're trying to get the benefit of what a coffee enema might provide, even if you're avoiding coffee per se. Are the recipes in your book okay for this? Yes, Christina, that's why they're in my book. We've got 31 recipes in No Grain, No Pain. So there's an arsenal of recipes that you can tap into if you're getting ready to start the program. Haha, Michael says, please start selling shirts. I want to buy one so bad. Yeah, we don't sell shirts. We give them away, but we don't sell them. As a matter of fact, that's part of our package for the person that makes one of the best transformations during this 30-day challenge. We're going to be giving away a lot of shirts to our gluten-free warriors who are making life-changing transformations. When's the best time to take Biotic Defense? Empty stomach or with food? Best is empty stomach in the evening before you go to bed, and that's best. But you can still take it at food if you can't manage that nighttime dose. Can bring gluten sensitivity? I'm not sure I understand the question because it seems like there's maybe a typo. Can you bring me a... Oh, okay. Is the diagnosis of gluten sensitivity, is that as a medical diagnosis? Can that save me money if I'm spending more money being gluten-free as a medical expense on food? I guess that's your question. My advice is what you would save as far as your taxes are concerned because you're buying gluten-free food because of a medical diagnosis of gluten sensitivity is not very much money. It's pennies. I mean, you're going through a lot of effort to not really save a whole lot if that was your question. Let's see here. How about using a far infrared sauna to aid in detox? Sure, you can use an infrared sauna, but you know, free infrared, my favorite form of free infrared energy is sunshine. Why would all kinds of symptoms start after weight loss? It's supposed to be healthy to lose weight because of angry fat. Angry fat. What does that mean? What is fat? The myth in today's world, like we're fed BS from the cradle to the grave, right? We've got marketing experts that are designed to feed us simple information to make us and to manipulate us into doing what they want us to do, right? And one of the things that we've been told, really in the last 30 years, we've been told this is a complete lie. Big is beautiful. Now, if you're big, don't take this as an affront. Don't get your feelings hurt. If you're big, it's different than if you're overweight or obese. So when I'm talking about big, I'm talking about obesity. I'm talking about fat, right? What is fat? Fat is an endocrine tissue, and it's inflamed. That's when we overstore fat, it's inflamed tissue. And so when you're big because you're obese, you're inflamed. You have a disease, right? It's not beautiful to be sick. I don't care what anyone else is telling you to justify the continued behaviors that you're having that got you to where you're at. Usually they're trying to sell you something. Fat is an inflammation tissue. The more fat you have on you, remember fat doesn't just store fat molecules of triglycerides, it stores toxins. When you're losing weight because you're doing things right and you're exercising and you're stripping that essential fat off of your body, that inflammatory fat, you're pumping those toxins into your bloodstream. And so some people go through a detoxification process where they feel worse before they feel better as they're losing that weight. And that's not an uncommon thing to see. It doesn't happen to everybody, but it can happen. And so if you find that when you're losing weight as you change your diet, that's part of what's happening, that most likely is the reason. Another question, do lentils cause inflammation? They can, and that's part of why they're not on the no grain, no pain phase 2 aspect of the diet, is that for many people they do cause inflammation. Let's see here. Keep going down on that left side. So questions coming up about lactobacillus containing histamine. I think somebody misunderstood me at some point. Lactobacillus is a probiotic, or is a microorganism. It's a bacteria, it's a family of bacteria that does not contain histamine. But certain strains of lactobacillus can heighten histamine levels in the GI tract. But lactobacillus as a whole contains no histamine. There's no histamine in lactobacillus. There are just certain species of lactobacillus that can elevate or raise histamine. That's why if you're following like a low histamine diet or a histamine-free diet, and I was talking about this earlier, if you're looking for a probiotic to support that, that's gluten-free, grain-free, check out our Biotic Force. That particular probiotic is predominantly a spore-based probiotic, and it will not lead to an increase in histamine response. Do I recommend intravenous vitamin C for prevention? Not really. I do if you're sick. I mean, intravenous vitamin C can be very, very effective if you're really super sick. So it definitely can be effective in that regard. Let's see, I answered that one. Can quercetin help reduce inflammation causing joint pain caused by oxalates being gluten-free for a year? Can quercetin help reduce inflammation causing joint pain? Yes, it can. It's one of my favorite things to use is quercetin and vitamin C as a natural anti-inflammatory support supplementally. Now, if you've got high oxalates, joint pain caused by high oxalates, there are reasons why that happens too. And for most people, some people overdo, we see this a lot in the vegetarian community, overdo juicing and greens. And these are high oxalate items, and especially in the spring months, big time. And so you can overeat them. And so it can be more than what your body is capable of breaking down. But another area where we'll see high oxalates, especially persistently throughout the year, not just in the spring, is somebody who either has mold in the environment. So you're living in an area, in a home where there's mold, toxic mold, or you have mold or yeast growing inside of you. Because mold metabolically can produce oxalate, and so they can actually drive up your oxalate level. So if you've ever been told you need to go on a low oxalate diet just because, without any kind of objective evidence or proof, one of the first things you need to ask your doctor to do is rule out whether or not you have mold in you or mold in your environment. And you can also check your diet, in this way and go on a lower oxalate diet. But this is something I see on a really, really common basis, is that mold piece leading to oxalate elevations. Okay, let's see here. Can a person be on blood thinners, B12 shots, and not making blood? Unhighlight that. Celiac diagnosis. How can a person be on blood thinners, B12 shots, and not making blood? Oh, I see. Okay. That's from Carolina. So if you're on blood thinners and you're taking B12 shots and you're not making blood, first of all, there may be what do you mean you're not making blood? You're not making blood as in the volume of blood, or you're not making red blood cells, or you're not making white blood cells? We're not making platelets. Which aspect? Give me better clarity, and I can give you a better answer for that. What causes eyelid twitching Only in my left eye, started 2 months ago. Look first to magnesium deficiency. It's one of the most common causes of eyelid twitching. Check out Ultra MG, Ultra Magnesium from Gluten Free Society. It's a great magnesium product. Blood thinners is medication doctors may give you when you are dehydrated like I was. I don't know, see the question in that, but that's not a reason to give blood thinners. If you're dehydrated, you don't take a blood thinner to correct dehydration. You take fluid to correct dehydration, because the definition of dehydration is lack of adequate fluid, and the blood thinner is not going to solve that issue. When's the best time to take probiotics? I think I answered that. The best time is at night for bedtime. What about salmon instead of omega-3 as a food-based omega-3? Perfect, yes, eat salmon, but make sure it's not farm-raised. Make sure that you're eating salmon that is wild-caught. I meat-only diet because I couldn't eat anything. Still can't. My hair fell out, my bone pain now. So some people do really well, at least initially, on a carnivorous-type diet, but longer term, as you heal and repair, you're gonna want to try to introduce some other foods as you're capable of tolerating them. What do you need to help with restless leg? Depends on what's causing it. Lots of different reasons you can develop restless leg. You can have probiotic deficiency, you can have folate deficiency, omega-3 fatty acid deficiency, you could have too much caffeine in your diet, you could be having food sensitivity reactions. So there's just a laundry list of different reasons why restless leg can occur. Okay. Yeah, if somebody was saying I took Biotic Defense and got a lot of gas suggestions, you might try Biotic Force. It might be a better probiotic for you to use. It's a spore-based probiotic. Sometimes people don't do well with bifidobacter and lactobacillus-based probiotics. It can cause them more gas, so that spore-based might be a better option for you. Let's see. What can you do for cortisol levels to be right? Quit being inflamed. How do you get tested? You got to get with the right kind of doctor. Most doctors, they'll run a blood cortisol level, you generally first thing in the morning, and that's it. Cortisol is not a single hormone. It's a diurnal hormone, so it changes through the course of the day. Generally, you make very high cortisol in the morning. You make lower cortisol as the day goes on. So cortisol curve kind of looks almost like an L shape as it starts out high and it moves its way down and then stables off at nighttime. So you need to have a doctor that measures your cortisol at different times of the day so that you can get an accurate assessment of what is actually going on with it. As far as how do you make it normal, you have to find out what's causing it to be abnormal. Cortisol is a stress hormone and it will be elevated for a number of different reasons, but anything that induces stress will elevate cortisol initially, and the longer the stress stays with you over time, your cortisol levels will cease to be elevated and they'll start to drop, they'll start to plummet, and that's what some doctors refer to as adrenal fatigue. Why does drinking wine cause a debilitating cramp in the back of my thigh? It's probably got to do with the fact that your body's telling you quit drinking it. So you can, there are a number of, so there's, especially if it's happening relatively quickly after the consumption, the body has this very unique way of sending you a message to say stop it. Most people ignore that message and do whatever they're doing anyway, or they medicate the message, right? So there's not like a mechanism of action per se where wine causes muscle cramping outside of alcohol dehydrates and can cramp you. So that boils back down to a quantity of wine that you drink. If you're drinking 2 or 3 ounces of wine, it's probably not going to dehydrate you to that extent. If you're kicking back 2 or 3 glasses of wine with friends or family, at a holiday party, yeah, you're going to potentially get cramps because it can dehydrate you. Can vitamin C powder increase iron labs? Not to any significant degree. We generally don't see major increases in iron with vitamin C unless you're really mega dosing it for a pretty long time. I like this. So Tanji says, I've been following a grain-free diet since November. I just want to say thank you so much for this information. After years of pain, inflammation, brain fog, I finally feel like myself again. I've learned so much about what works for my body, and I'll never go back to eating grains. I've also purged myself of artificial sugar and unhealthy additives and preservatives. I truly believe your book saved my life. Well, that is wonderful to hear, Tangi, and thank you for sharing that with me. That gives me the fuel and the drive and the desire to keep pushing this message, because I know it's life-changing and life-saving. So thanks for sharing your experience. Let's see, do I have a B-complex brand to recommend? Yeah, it's called B Complete. B Complete is the name of the B-complex vitamin formulation that I have. Do you check for mold? I don't know, do you check for mold, or how do you check for mold? The way you check for mold, there's several different ways. There are a lot of lab tests that can help a doctor identify and help understand whether you're being exposed to mold and toxins of mold. That being said, that's step one, is getting with somebody who understands it. Because if you get with a professional who doesn't understand mold but claims they do, you're going to find yourself struggling to get that puzzle figured out. Mold is such a complex topic, and we don't have time to get into that tonight. Surgery for ptosis. Can gluten cause ptosis due to nerve and muscle damage? I've seen it cause ptosis, definitely, Maxine. So, it's potential. That is a possibility. There are other possibilities, though, for lid lag as well. And so viral infection is one of those other common possibilities that can sometimes do it, too. Okay, we're wrapping it up here. Yeah, okay. So I think a lot of these are commentary more than they are questions. So and the list goes on. So we're about 20 minutes after. I'm hungry. I'm going to go home and eat. Look, I hope this was informative for you. And remember what our mission is. This is 2022. We're just as excited for this year as we were for last year. But what is our mission? It's to help save 100 million lives. And so in order to do that, I need you to help me. With all the vast censorship of great information that we've had over the past 2 years, the only way we get this out is word of mouth, grassroots efforts. So share this with somebody that you love. Copy the URL, paste the video, send it to a friend, neighbor, relative. Don't be stingy. Help me get the word out with this life-changing and life-saving information. Hashtag save 100 million lives. Make sure you use that hashtag. 2, if you're not subscribed, if you're new to the show and you want to learn more and you want to get on our mailing list so that we can give you updates and send you the link to the live show every Monday night, go over to glutenfreesociety.org and make sure you subscribe to our newsletter. It's the only way I can really ensure a lack of censorship on our part to your part, right? Through these platforms like Facebook and YouTube, we are being crunched and basically we're being shuttled away from the masses, from the directory of the masses. So if you want to stay on my list and you want to stay in the loop with my information, make sure you go to Gluten Free Society and subscribe. So we will see you back next week. We're going to dive into more strategy around no grain, no pain and help you do this kickoff challenge. Again, this officially is starting. We're starting 2022 off right with the no grain, no pain challenge. The winner's going to be presented, and we've got lots of prizes and gifts in this contest. So stay tuned. Next week, we'll be back for another episode of Pick Dr. Osborne's Brain. Have a fantastic week and Happy New Year. Hey, if you've got a functional medicine or health question that you'd like me to answer for you, make sure you send me an email, glutenology@gmail.com, and we'll do our best to create a video answer just for you. Have a great day.